Now, I think all of us, as we're getting older, and again, Alzheimer's and age-related macular degeneration, they're not handed down in the genes. Well, not really handed down in the genes. But O'Flaherty's Pharmacy and Athenry in Athenry is to provide free risk factor screening for Alzheimer's and age-related macular degeneration. Professor John Nolan is from Waterford, and he's done a tremendous amount of work in it. He joins me on the line. Gráinne O'Flaherty, who has the pharmacy in Athenry, will join us also shortly as well. But again, get a pen and paper, because this will be of benefit to you. And good morning to you, Professor John Nolan.
Good morning. Very nice to join you.
Thanks for joining us today. Now, I'll talk to Gráinne in a moment about the screening that's going on and the test measures for, is it carotenoids? Did I pronounce that correctly?
Yeah, carotenoids. So basically the carotenoids are the pigments that you see in healthy foods, plant-based foods, fruits and vegetables, the colours you see in carrots, the colours you see in peppers, the colours you see in egg yolk, anything that's natural and colourful is because of a nutrient called a carotenoid. And these are the nutrients that we've been studying that are very important for human health and human function.
How important are they, can I ask you?
Yeah, well, to understand them, basically there's 700 of them in nature. They live in plants and they help plants survive. But when we consume the plants, we consume about 50 of them. What's remarkable is that there's 3 carotenoids, lutein, zeaxanthin and mesozeaxanthin, that are highly concentrated at the retina. So that's the back of the eye, the film of the camera, if you like. And what we've identified is that when you have these carotenoids, you can enhance the protection of your eye. You can enhance the antioxidant effect it has and how it uses light. So you really just keep that tissue healthy. But what we know is that we are highly deficient in them, and particularly patients with the disease macular degeneration or at risk of this disease are deficient in them. So our science has been able to extract them, if you like, from flowers, marigold flowers from Mexico. And as we've done that, we've been able to test them in our human studies in different population groups with great effect.
So then that brings in the likes of Gráinne O'Flaherty indeed, and other pharmacists right across the country, and they're going to have these screening events as well. And Gráinne sits off to me today. Gráinne, good morning to you.
Good morning.
Thanks for joining us today on the programme. You've decided to do this screening, and it's going to take place on the 20th of September between 11 o'clock and 6 o'clock in Athenry Shopping Centre in the O'Flaherty pharmacy there. Why have you decided to do this?
What we're screening for is a risk factor for Alzheimer's and age-related macular degeneration. And I have personal family experience of both of those diseases. So this is the first time ever that in a pharmacy we can screen for low carotenoids. And from the work that Professor Nolan has done, we know that low carotenoids are a risk factor, or a cause almost, for low age-related macular degeneration, and they are found deficient in people who have dementia. Okay, so we can, it's a very easy test. A person will just put their finger onto a machine for a couple of seconds, and it will give the result after a minute whether they are low in carotenoids or not. So it's very helpful for those people who think that they might be mildly cognitive impaired, that they would benefit from taking the supplement from Professor Nolan's work that he's done, from his study last year that was published. And also,
so it's important then, so if they want to go along then on the 20th of September, you're doing it from 11 o'clock until 6 o'clock. Is there a charge involved in this?
No charge. And for anybody who might have, thinking about the rest of the country, this has been done in a lot of pharmacies around the country, and there's a website that people can check that will alert them to the pharmacy in their area that is doing the screening. Okay, so we're screening for low carotenoids, which is what Professor Nolan has identified as being helpful if to be supplemented.
Professor Nolan, we'll say that they're found to be low levels of this carotenoid.
Yes.
And Gráinne mentioned a supplement. How quickly can you retest again just to see if there's been an improvement?
Yeah, that's a great question. So it's not a silver bullet, so it's not like taking a paracetamol or Panadol there. You get a systemic initial effect. In order to increase your protection by using these nutrients, it takes some time for them to be accumulated. And the reason for that is they're found all over our body, right? So when you eat them, they have to go into your stomach, and then they go on a journey, a bioavailable, we call this how bioavailable they are. And in terms of this supplement, they're highly bioavailable, but even with that, it will have to saturate the transport systems, which is our blood system, and fill up all the reservoirs throughout our body, if you like. And then they find their way to the retina and the brain alike. We see from our studies that really you will be looking at to change the target tissues. It takes about 6 months. We see the skin to respond rather a little bit quicker than that. So you'll see it maybe at about 3 months. But ultimately, this is part of a good positive lifestyle change, enhancing your nutrition. And what I like to say about it is, like, I kind of challenge the concept in today's world that, be well, eat healthy. Of course, we know we should do that. The challenge I have is, how does one comply to that? And can we get enough? And that's the advantage of today's science, is we've been able to, if you like, identify what's good about good nutrition, extract out and concentrate the carotenoids and make them available in a very consumable form for patients and for the general public. These are something that all of us benefit from. When a mother feeds her baby for the first time, the colostrum, the first food, is coloured because of these same carotenoids. So throughout our life, these carotenoids play a vital role in our health.
So it's a big breakthrough then, Professor John Nolan.
Oh, absolutely. And, I'm giving some lectures this year at the major events for ophthalmology and for, the work in Alzheimer's with the geriatricians and so on. And, we see in the news the whole time about new drugs and in terms of treating these conditions. And, the reality is, while pharmaceutical drugs are very important if they work and when they work, and that's one part of medicine. But a part of medicine that really doesn't get enough attention is the kind of the work that we can do that's affordable and pre all of these end stages of disease. And so the breakthrough is that if we optimize these nutrients, which we can now do in a very safe way and feasible way, throughout our life, we can, in theory at least, stop these diseases developing in the first place. But really, it is a breakthrough because the science of today, and thanks to the work that we've done here in Waterford, and indeed in our collaborations with universities across the world, we have been able to measure things the way we haven't before. So, Gráinne mentioned the very good work that's been done at screening level in pharmacy. That wasn't available 5 years ago. Our ability now to measure these carotenoids in the skin, which are a correlate of what we would have been able to do in terms of the eye, that's another part of the breakthrough. So access to the nutrients and a way to detect if those nutrients are required and how we can change them in real time. Yeah, it's a very exciting time for health, and I'm delighted to see pharmacy and optometry, eye care, and everyone alike be proactive in this, because we can't afford these diseases, the impact they have on families and, of course, the sufferers. No one wants to lose their vision. No one wants to develop Alzheimer's disease. And while we may not stop the disease directly, we can definitely impact on the rate at which they develop and the symptoms of it, if you like.
Yeah.
Thank you, Professor Nolan, for joining us. Gráinne, I know you want to come in there again. So this is very important for people. So 11 to 6?
11 to 6. And September 20th, which is a Wednesday, and people can ring and arrange an appointment with us, okay? And just want to say thanks, because all of this came about from Professor Nolan's work in Waterford over the last 20 years and a progression of different studies. And that last study that was published last year, just in dementia, mild to moderate, the carers reported an improvement in memory and mood and the ability to do day-to-day tasks like dressing themselves and making a cup of tea. And that's like a big win.
Yeah.
For those people,
it's giving them. What's the best number for them to ring to make an appointment?
091 875 030.
030, and it's free of charge. The whole screening is free of charge. So 091 875 030 for the details. Now, this is going to be taking place in O'Flaherty's Pharmacy in Athenry, indeed, County Galway. So what you have to do is make your way to there, but you need to make an appointment. 091 875 030. Do you have the website where people can check it elsewhere if they're listening to us elsewhere?
Yeah, WMO Healthcare. And then you click on the screening days, and it gives you a screening days for around the country in the different pharmacies.
So give that to me again,
WMO Healthcare.
MO Healthcare from there. CARE. Gráinne, thank you for joining us, and Professor Nolan, thank you for joining us as well on today's programme.